Dear students, welcome back. Now we are going to see the anatomy of the lungs. Here, the lungs are a pair of respiratory organs. Lungs are pair of respiratory organs which are situated in the thoracic cavity, and each lung is invaginated into the corresponding pleural cavity. It is having a right lung and a left lung, and this right lung and left lung are separated by a space which is present in between them, called as mediastinum. So lungs are a pair of respiratory organs situated in the thoracic cavity. Each lung invaginates into its corresponding pleural cavity, and the right and left lungs are separated by a space called mediastinum. And how this lungs, now we will see the texture of this lungs. Normally these lungs are in spongy in texture. And now coming to the color of the lungs, in the young the lungs are brown and gray in color. The lungs are brown and or gray in color. Gradually it becomes malted black, so it turns into black in color because of the deposition of the inhaled carbon particles. So in young and in earlier ages, the lungs are in brown in color or gray in color. Gradually they become into malted black because of the deposition of inhaled carbon particles. And the right lung weighs about 625 grams, and it is about 50 grams heavier than the left lung. That means the left lung weighs about 575 grams. So this is about the general introduction of the lungs. Now coming to the features of the lungs. So each lung, if you take each lung is in conical in shape, and it is having an apex at the upper end and base at the lower end. Okay, so it is having an apex and a base. So apex is present on the upper end and base forms the lower end of the lung, and the lower end is resting on the diaphragm muscles. Lower end is resting on the diaphragm muscle, and it is having three borders. So the lung is having three borders. One is the anterior border, next one is the posterior border. It is having posterior border, we can't see here, it is present on the posterior aspect. And next one is the inferior border, it is having inferior border. So how many borders? This is having three borders. One is the anterior border, posterior border, and inferior border. Okay. Now coming to the surfaces, it is having two surfaces. One is the costal surface. So the costal surface is normally it is a convex. So the surface, so the lung, the part of the lung which are related to the ribs, up to that area, the surface is called as costal surface. So the costal surface somewhat related to anterior, lateral, and also some posterior surfaces forms the costal surface. And next one other surface is the medial surface. So the medial surface is related to the mediastinum. Okay, so how many borders are there? It is having three borders and two surfaces. Okay, again we will see the features of the lung. Each lung is conical in shape, and it has an apex and base, and it is having three borders. One is the anterior border, next one is the posterior border. Posterior border is present on the posterior aspect, and the next one is the inferior border. So how many borders? Anterior, behind you'll have the posterior border, and below you'll have this inferior border. Okay, so this is about the borders. And coming to the surfaces, it is having two surfaces. One is the costal surface and another one is the mediastinal surface. Costal surface and mediastinal surface. Now we will see the apex and base here. So apex. So the apex is blunt. So here the apex is blunt and lies above the level of the anterior end of the first rib. So we know that. So here the level of the clavicle, we can see here the level of the clavicle, and below this we'll have the first rib. Yes, first rib is present, and here we will have the sternum. Okay, first rib. So this forms the apex. Okay, so the apex is blunt and lies above the level of the anterior end of the first rib. It reaches nearly an inch above the medial 1/3 of the clavicle, just medial to the supraclavicular fossa. Just medial to the supraclavicular fossa. Okay, and this apex is covered by cervical pleura. So I have already explained this cervical pleura, that is called suprapleural membrane. It is attached to the transverse processes of the cervical vertebrae, and it is getting attached to the clavicle, isn't it? So that fascia separates the neck and the thorax also. So the apex of the lung is covered by a cervical pleura and by suprapleural membrane. Cervical pleura means the pleura which is surrounding at this level, it is called as cervical pleura. Over that suprapleural membrane is present. Okay. And it is also grooved by the subclavian artery on the medial side. So subclavian artery, so which is coming below this artery, so on the medial side and in front. So like this the subclavian artery will come. Okay, so the apex is related superiorly by the cervical pleura as well as the suprapleural membrane, and this apex is related to the subclavian artery on the medial side as well as in front. Okay, now we will see the relations in detail. So anteriorly, I have already told that it is related to the subclavian artery, and also it is related to one muscle called as scalenus anterior muscle. Scalenus anterior muscle, which is present in front of the artery. So actually it is originating from the vertebral column, and this scalenus anterior is what you call inserted on the over the first rib. Okay, so this is the relations of the apex of the lung. Okay, so in front it is related to the subclavian artery and the scalenus anterior in front of the artery, and posteriorly it is related to first intercostal nerve. Posteriorly it related to first intercostal nerve, and also it is related to the seventh cervical. Posteriorly it is related to the seventh cervical and first thoracic sympathetic ganglion. So posteriorly it is related to the seventh cervical and first thoracic sympathetic ganglion. So you people know how the sympathetic ganglion is formed. I have explained in the course of the intercostal nerve, spinal nerves. Okay, next, and also it is posteriorly, it is also related to superior intercostal artery. Superior intercostal artery. So just go back to this arterial supply in the thoracic wall. So at the apex level, these are the nerves, and also this artery is present, and also the muscles related at that side. So posteriorly it is related to the first intercostal nerve, and also the ganglion, stellate ganglion, or the seventh cervical and first thoracic sympathetic ganglion on the posterior aspect. And superiorly it is also on the posterior aspect, it is also related to the superior intercostal artery. Superior intercostal artery. And laterally, so coming to the lateral side, laterally it is related to the scalenus medius muscle. Scalenus medius muscle. This is also another neck muscle. Scalenus muscle is having three types of fibers. One is the scalenus anterior, medius, and posterior. So this scalenus medius is related to the lateral side of the apex of the lung. Okay. Now coming to the medial side, the apex is related on the right side of the lung. It is related to the right brachiocephalic vein, brachiocephalic artery, and the right surface of the trachea. And coming to the left lung, the apex of the left lung is related to the left subclavian artery and the left brachiocephalic vein. So the remaining relations are same for both right lung and the left lung. Okay, so again we will see the relations of the apex. So the apex, so this apex of the lung is projected into the root of the neck above the level of the first strip, above the level of the first strip, and also it is present above the level of the anterior end of the first strip, and it is also above an inch to the medial 1/3 of the clavicle, which is just medial to the supraclavicular fossa. And this apex is covered by the cervical pleura, and over this it is covered by the suprapleural membrane. Okay, and this is the superior aspect of the apex relations. Anteriorly it is related to the subclavian artery and the scalenus anterior muscle. Subclavian artery and the scalenus anterior muscle. And coming to the posterior relations, posteriorly it is related to the first intercostal nerve and also seventh cervical and first thoracic sympathetic ganglion, and also posteriorly it is related to the superior intercostal artery. And laterally it is related to the scalenus medius muscle. Laterally it is related to scalenus medius muscle. Medially, especially towards the right lung, medially it is related to the right brachiocephalic vein, brachiocephalic artery, and also the right surface of the trachea. Coming to the left side, this apex is related to the left subclavian artery and the left brachiocephalic vein, and the remaining relations are same as that of the